Hey y'all, I said I'm gonna start doing a little better with engaging with my babies on here. I'm always on Instagram, but it's a different, I know it's different. Some people rock with TikTok more than Instagram and Facebook and whatever. So I'm gonna be trying to maneuver on all platforms. But I had a lot of y'all come to my Instagram, ask me questions about the silicone removal, and a lot of y'all been asking me questions about what my healing process has been with my BBL, because those of y'all that have followed me and know a couple years back, I had the BBL. I ended up having issues with it, but the BBL was reconstruction from the silicone removal. So, not doing silicone tonight, but the BBL, I ended up healing good. Like the fibrosis, I ended up getting rid of really pretty much everything with fibrosis. My stomach is still a little tight, but I ended up having a baby. I got pregnant probably 7 months after my BBL. So, and I know a lot of people like, you got pregnant, you got your body done, and then got pregnant. Well, pause. Wasn't really me getting my body done. The BBL wasn't for me to be, I want to get snatched. I want my ass big. I want a small waist. No, the BBL was for me to get fat to put in the areas of my butt, not my whole butt, just it's an area on each side that had a dent. Because the doctor took so much fat out because he had to dig through, my ass to get as much silicone as he could, because we know it's not in a bag. It was just shot in me. So that fat is not gonna come back. So it's a dent on each side, almost like hip dips, but it's in the side of your ass. So I had an option of doing butt implants, the BBL, or Sculptra. Sculptra, expensive, and I feel like a waste of money. It's almost like getting fillers in your butt, so it's not gonna last. It's not permanent. I wanted something permanent. I didn't feel comfortable with butt implants. I don't like the way they look, so I just went with BBL. So the BBL was never for me to just get my body done. It was for reconstruction purposes, which the BBL ended up not taking. So those of y'all that know, with the BBL, sometimes the fat, all the fat dies. Most of the time, it's just some of it. It's like 30, 40% of the fat dies. And then you have a certain percentage of your butt that's swollen, that's going to go down. And then, then you have the rest of it. The remaining is the fat that lives. And then you go through the fluffing stage and all that extra shit. But my fat didn't make it. So rewinding back, before the fat didn't make it, my doctor told me to gain 15 pounds. Red flag. I'm small frame. I should have never been told to gain 15. He should have told me to gain 30. Just off rip. I'd rather have more fat and you throw shit away than me not having enough. So what ended up happening, because I didn't have enough, when I got there, he looked at my stomach. He said, you don't have enough fat. So I'm like, what you mean? I said, don't tell me that. And I done just came, way to the West Coast to get this work done. He said, you have a lot of visceral fat, not subcutaneous. Visceral fat is the fat that's around your organs that you're not supposed to touch, because you can puncture an organ and die. Now, overseas, I think they might play around over there trying to get as much fat as they can out. But you're not supposed to mess with visceral fat. And he said I didn't have a lot of subcutaneous fat. So he said he was going to do what he could do. Another red flag. So him doing what he could do was damaging my tissue, because now he got the cannula and he going in. Because he trying to go any which way he can to find fat, but that I don't have. So in the midst of him doing that, he damaged tissue. Of course, you're going to damage red blood cell, but I mean, it was just like overkill on my stomach. So of course, after the surgery, I'm swollen. I had posted something on TikTok, and that one is at the top of my pin that ended up going viral. A lot of people was like, oh, you got fibrosis, you got this and that. I feel like it was too early to tell that I had fibrosis. I think I was like, I might have been 4 weeks out. I don't know. Some people were saying I had it, but I really was swollen, and I had started getting massages. So maybe they knew. I don't think they knew what the fuck they were talking about, but I ended up getting it. So maybe they didn't know. I don't fucking know. Either way, people always have something to say. But regardless, I ended up getting fibrosis. So as my swelling started going down, because I was getting a massage, my swelling going down, my stomach started getting dark. So as my stomach started going down and it got dark, it started looking like this. Okay, so now I'm like, whoa. Like, I don't think this is normal. And we hitting like 6 weeks. I should not still be bruised 6, 7 weeks out. But I was, and it's getting darker. So the doctor trying to pacify me. Well, I'm not even talking to him. I'm talking to the nurse. The nurse is like, oh, it's just bruising. It'll be fine. Give it time. I'm like, listen, I've never had a BBL before, but I've had surgery. I've been bruised. I bruise easy. Bruises don't get worse and worse. Over time, they lighten, and you start to heal. Why is my bruising getting darker? And I mean like 6, 7 shades darker. So finally, I do some research, and it's called hemosiderin, which is called skin staining. And it's you can get it after lipo and from aggressive lipo and damage of red blood cells. It causes like an overproduction of iron or something, and that's what makes it so dark. But it's called skin staining. So once I hit them back up and was like, it's most definitely not bruising, it's this. Right away, I get a prescription for bleaching cream. Why are you gonna give me bleaching cream if it's just bruising? Because y'all full of shit. But this is what some doctors do after they get your money. They kind of like push you aside because now we're trying to move on to the next patient and get somebody else's money. So I complained about my stomach. So they saying, just do this, do that, get wood therapy, do this and that. I've seen a lot of women on social media. I have friends that have had it done. They were not going through this. So I knew this was not something that was part of the healing process. I knew something was wrong. So anyway, I started going to somebody and I started getting fibrosis treatment. So she did mad shit to me. Like I'm a pin her at the bottom. She got me together. I used to always show my stomach like before this. So I was really upset. Not only did the fat go away in my dents, because he didn't do my whole butt. He just did the dents. I told him I didn't want my whole butt done. So not only did the fat go away, I done gave this man $15,000. Yeah, $15,000 because this was considered reconstruction. This was not a regular BBL. $15,000 for this. And this. And this. $15,000. So I'm now thinking, where's your moral compass? Because you know you dropped the ball with me. He's done a few other girls after me, and they look good. So I can honestly say sometimes mistakes happen. You dropped the ball with me because you didn't tell me to gain enough weight with me being smaller frame. So you don't think to, let me try to make this right. Nah, I ain't heard shit from him, which is cool. He did his thing with the removal. I would not recommend him for reconstruction. And as my doctor was Dr. Katzen. That's just me. Like I said, he did good with other women, but he dropped the fucking ball with me. So you see how my stomach was looking, boom, 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 right? Okay. So this is where I'm at now. So as you can see, way better. I'm talking about much better. When I pull my stomach up, you can see a little imperfection, and it's still tight. It's not bad tight because, like I said, I just had a baby. So, and it's a couple dark areas, but overall, if I'm just regular, not bad at all. Like, this is cool. I'm happy. It's not what my stomach was before, but compared to this bullshit, I heal well. I would say it was painful, but I healed. If y'all got any questions, y'all can feel free to hit me up. Whether y'all want to talk about silicone, y'all want to talk about BBL, I need y'all to go watch my documentary. That shit is informative as fuck. The link is in the bio. Just reach out and hit me. Like, this is a safe space. We not doing all that judgmental shit. A lot of women need somebody to talk to when they're dealing with these situations, whether it be BBL, botched BBLs, or getting the silicone removal, you having issues with your butt shots, just all of that. This is a safe space. Hit me up if you have questions, if you want to talk, but watch my documentary, and I will be back on here engaging with y'all and getting to know y'all, and y'all getting to know me. So yeah, I'm back.